What is cancer? By discussing this, we can have strategies to prevent it. So, cancer is a cell, whether it's in your colon, your breast, your skin, decides to start multiplying uncontrollably. And it rapidly becomes a little nodule, a mass, and then the mass can metastasize, which means the cells move on into the rest of your body. That you don't want because that's considered stage 4. For most stage 4 cancers, there is no cure. But let's go a little deeper. What is a cancer cell? Most people think it's a normal cell, cancer cell. It's incorrect. There's gray zones. And especially a woman that has a pap smear probably experienced this. So again, it's not all or nothing. Cells can change, that they're not normal, but they're not cancer. So we have different categories in classifying cell change heading towards actual cancer. So we have anaplasia, which is almost on the doorstep of becoming cancer. It has to do with the nucleus, the changes within the cell. Metaplasia is the cell has changed and is not normal, but it's not anaplastic and it's not cancer yet. So when a bodybuilder builds muscle tissue, the cell gets larger primarily. It doesn't change its nature, its characteristics. So the point is, you don't want the cell to go down the path from white to black. You can prevent that from happening. And if you go on the National Cancer Institute website, it'll talk about diet being very preventative, eating lots of vegetables and fruits. Exercise decreases cancer. Let's take breast cancer. According to the American Association of Clinical Oncology, a book right behind me, about a year old, very well referenced, mainstream medicine, women who exercise regularly decrease breast cancer 20 to 30%. That is quite huge. Mini fasting, there was an article in the JAMA, Journal of the American Medical Association, August 31st, 2016, and it took women and separated them. Women, let's just say 100 women, you're going to mini fast every day, meaning you're not going to eat for 14 hours. So you finish dinner, let's say at 7 o'clock. You're not going to eat until 9 o'clock in the morning. That's not very difficult. So no noshing, no snacking, just water. Tea is okay without any sugar, honey, or cream. And black coffee was also allowed in the morning without anything in it. 14 hours, approximately 36% decreased reoccurrence in women with breast cancer. That is also very significant. So a diet rich in vegetables and fruits, exercising, trying to get a grip on stress. When I ask patients, why do you think you got cancer when there was no family history, no apparent reasons? They exercise, diet, they all say stress. So stress can turn off the immune system, cause the endocrine system to derange, and all causes of cancer can be related to possibly stress, because it's an emotional component, and again, it can alter the immune system, the endocrine system. In any event, proper sleep, again, exercise, diet, mini fasting. I mini fast every day, way more than 14 hours. I think it's very helpful, and people are doing it for longevity. Let's get back to cancer. So a woman has the pap smear, and it could be metaplasia. They repeat it, and they make sure that it didn't go down the path to finally cancer. If it does, they do a colposcopy, they remove the cancer cells. Prostate cancer is graded in a Gleason's grading system, and it has to do how severely did the cancer cells change. So it's exactly what we're talking about. It's not black or white. So cancer prevention in my book is the most important thing, because the adage, an ounce of prevention is worth a pound of cure. It's so true. It's so true. Prevention goes deeper than that, though. So having yearly physicals, doing colonoscopies, doing ultrasounds, mammograms, MRI of the breast, Pap smears, that is prevention, because if you pick up the cancer early, you can prevent it from spreading and not being curable. Self-exam. Women should examine the entire breast, under the axle of the underarm, and above the supraclavicular space, there's lymph nodes. Sometimes you can't feel a nodule in your breast, you feel it under the underarm. So cancer, you want to pick it up early to prevent it from metastasizing, spreading in the body, and not being curable. I can't overemphasize that. If you have a lump, don't wait thinking it's going to get better on its own. See the doctor, get evaluated for further testing. If you have blood in your urine, it could be bladder cancer. Blood in the stool, dark stool, it could be colon cancer. Again, you need to pick up cancer in the beginning. Cancer moves fast, you have to move faster. Now, what initiates normal cells to become cancer cells? Well, there is genetics, the BRCA gene. If you have the BRCA gene, BRCA1, you have a 65% chance of getting breast cancer, approximately 39% getting ovarian. If you have BRCA2, 45% breast, approximately 11 ovarian cancer. So genetics play a big part. And then there's epigenetics. Epigenetics is how the environment impacts the genes that you have. So if you think about BRCA1, we said 65% chance of getting breast cancer. Why didn't the other 35% get it? It could be their lifestyle. They exercised, they ate correctly, so those cells, the genes, did not trigger. It could be a two-hit theory or a two-hit causation. In other words, the genes are sitting there. We call them pro-oncogenes. They can fire and create cancer if you smoked. Interesting, smoking increases leukemia, cervical cancer in women. That's quite interesting. Things are very distant, but yet these bad lifestyles can make normal cells become cancer cells. And that's why, like if you have Barrett's esophagitis, it's a cell change. They have a higher incidence of esophageal cancer. And it goes on that smoking induces every type of cancer. Increases breast cancer, leukemia, head and neck cancer, throat, gastric cancer. And that should not be in anyone's life, obviously. And I'm glad to say you see less and less people smoking. So a cancer cell is not all or nothing. Try to prevent it from taking over your body by self-exam, the pillars of health, eating right, controlling stress, exercising, seeing your doctor. And a step further is looking at inflammation, making sure the blood tests that you undergo have inflammatory tests, C-reactive protein, sed rate, then there's many other tests that should be done to make sure that your body is not inflamed. Inflammation can cause cancer. That is a fact. Here is a book, and I have many articles on it. Vitamin deficiencies can cause cancer, normal cells to turn into cancer. This is just one example. Iodine. So there are many nutrients that can be measured. Vitamin D is huge. Vitamin D helps cells differentiate, which means that a cancer cell can be looked at as a caveman. And there are things to make it become refined and a modern person. But nowadays, maybe the caveman was better than the modern man. But anyway, so there's differentiation, meaning that the cancer cell can regress, or you can prevent the normal cell from becoming a cancer cell. An article, vitamin D controls over 200 genes to prevent cancer. So make sure your blood test contains several things: nutrients, inflammatory markers, and also toxins, as it is called by alternative medicine. Heavy metals, aluminum, mercury, lead, that should be tested when indicated. Hormonal testing should be tested when indicated. For instance, estrogen. There is a good form and a bad form. Estradiol is a good form. Estrione is the one that causes breast cancer and uterine cancer. So make sure you have a thorough blood test, and you're seeing your doctor on a regular basis, and you're paying attention to your body, you're listening to it. Don't ignore its signs of possible cancer or heart disease. If you're having chest pain, don't ignore it. Thank you, and give us a call if you want with any questions and concerns or suggestions for other discussions. The phone number is 631-361-6160. Again, 631-361-6160.